Essence of the healthcare system is to ensure that the patient is well, the patient receive the maximum treatment at the right time. Hello everyone, today we'll be talking about a very serious topic, a topic that is often overlooked. We think it is just a minor issue, but then it is not. It can cause a lot of havoc. And what is this topic? It is communication gap in healthcare system. So what is communication gap? When we talk about communication gap in healthcare system, we are talking about the breakdown or inefficiencies in exchange of information among healthcare workers. We are talking about the communication gap between doctors and nurses, nurses and lab technicians, doctors and pharmacists. And then what are the common causes of this communication gap? When there's lack of interdisciplinary collaboration, instead of working as a team, you see each group wanting to work on their own, a solo team, just on my own, and that doesn't help the patient, because the essence of the healthcare system is to ensure that the patient is well, the patient receive the maximum treatment at the right time, and the patient is able to go home hale and hearty. Another common cause of communication gap is time constraint. You see that a lot of hospitals, they are understaffed, and when you don't have adequate hands to perform a particular duty, you find out that there will be a lot of lapses. Then another common cause is improper documentation. If it is not documented, it did not happen. A lot of times when you see people, when documentation is not done properly, you find out that the information that the next person needs to work with is not there for the person to carry out his or her duty, and that is going to extend the patient's stay in the hospital. That might even cause the patient's life, or even cause extra cost for the patient, because it is not properly documented. And then there might be interaction. Over 70% of medication or errors occurs because of communication failure. Now, how do we bridge the gap? How do we come in as healthcare professionals? We have to work as a team. Most times you see some patients come into the pharmacy and they have a prescription in their hand, and it is not legible. They can't even read what is on the paper. And when the whatever is written on the paper cannot be interpreted properly, you find out that it's going to cause more delay in the patient treatment. It's going to cause a lot of back and forth. The pharmacist might want to call the doctor to ensure what he's saying is what the doctor wants. What it is written in the paper is what the patient needs. And because of that, it takes a lot of time. Sometimes maybe the patient doesn't even have the number of the doctor, or the doctor's number is not there. It's usually difficult for the patients to for the pharmacist to get the information he needs, and so there will be a lot of delay. And another this thing is proper documentation. If the patient weight is supposed to be stated on that sheet, ensure that the patient weight is stated there, because it's going to help the patient receive the maximum treatment the patient needs. Most of the drugs are require weight-based calculation. If the weight is there, it's easy for the person dispensing to know, okay, this is the weight, and then calculate to give accurate dose. And then if there's proper documentation on paper, when the person is handing over to the next person, all that person needs is to go through the paper and know what he or she is so expected to do with that information. We have to collaborate. We have to collaborate, and then we have to try as much as possible as to ensure that we have adequate staff in these facilities. A lot of times people are overworked, and when you are overworked, you cannot give your best. So I don't know, but the government have to just do their best. The facilities that have healthcare workers have to do their best to ensure that these places are not understaffed, so that the patient can receive the maximum outcome, and then the gap in communication can be bridged. Thank you.